Hello everyone, I welcome you for this video lecture session. Myself, I am Ruben from Vellore Institute of Technology. Today I am going to talk about a cardiovascular system and a very important diagnostic tool which is used as an indicating measurement for cardiovascular function identification. So in that aspect, first let me give you an overview about the cardiovascular system. When I say cardiovascular system, it is mainly used for the blood circulation and blood pumping. So that includes the main organs of the human body, heart. So heart is an essential organ which is a natural pump, which is used to pump the blood all over the body. So it collects the blood from the body and it sends the blood to the lungs where it is getting oxygenated. Then the oxygenated blood is recirculated through the heart. So there the heart plays a very important role in pumping the blood from the head to the toe. So here the cardiovascular system and the heart functions are determined by several parameters or several tools, diagnostic methods. In that, the blood pressure is a very popular and commonly used method, which is a primary indicative tool for the heart problem. So, blood pressure, a high blood pressure or a low blood pressure, it's an indicative tool for we can understand that there is something wrong in the heart and we can do some necessary treatments so that the heart can be it can regain its normal function. So we are going to discuss about the blood pressure measurement, and the overview of this session is like that. I'll be giving you some introduction about the blood pressure. Then we'll be seeing the different types of blood pressure measurements. In that, there are two very important classification of blood pressure measurement. We'll be discussing about that. Now, to start with the presentation, let me give you some basic introduction about the blood pressure measurement. Actually, before we go into that, basically pressure, what is pressure? Pressure is, the force per unit area, meaning force exerted on an area, that is pressure. So in the SI unit of pressure is Newton per square meter. So Newton stands for the force and Newton divided by meter square, that is area. So wherever the force is acting, you can experience a pressure there. Now coming to the physiological pressure, what is the physiological pressure? Physiological pressure means the pressure which actually we are measuring, we are going to measure as a tool for the blood cardiovascular system. So in the blood pressure measurement, the physiological pressure, it is exactly the same like the normal pressure, but here the pressure is generated by the heart, which is a natural pump, as I told you beginning. Now that blood which is pumped from the heart will be flowing through the arteries. When it is flowing through the arteries, it will the blood will give some force on the wall of the arteries, and that will create the blood pressure. Now because of this pressure only, we can ensure, the heart ensures that the blood reaches all over the body. Now if there is any variation in the blood pressure, that is kind of an indication that there is something wrong, that maybe the heart is not pumping properly, or there is a change in the arterial wall, the arterial area, or there is some thickness in the wall. There are so many underlying reasons are there for the variation in the blood pressure. That's what I said. Blood pressure is a primary indicative tool for the heart function. So by measuring the blood pressure, we can identify several things. It gives you a lot of information about the heart functioning. Now, what is this blood pressure is all about? As I told you, heart collects the blood, that is deoxygenated blood, from all over the body, and it pumps it to the lungs where it get oxygenated. The oxygenated blood will come back to the heart, and from the heart again it goes back to the rest of the body. So it is kind of a closed loop circulation. So this circulation is ensured by heart and the lung. Now where this blood pressure is coming, now when the oxygenated blood is collected back in the heart, this blood needs to be pumped to the entire body or body parts. So that where the blood pressure is critical. So if there is any variation, means if there is a low blood pressure, meaning the organs like the very essential organs like brain, kidney and all other organs may not get sufficient blood supply. And if there is some kind of high blood pressure, increased blood pressure, then it will leads to some arterial damages, and in a long run it may cause several other side effects and major effects to the body. Now, what is this blood pressure is the indication of cardiovascular system. As I told you, there are several other parameters. So the three main factors which controls the value of this blood pressure is the cardiac output, meaning what is the output, what is the blood output coming from the heart per unit time, that's called cardiac output, and the diameter of the arteries, and the quantity of blood, the volume of the blood. So these are the three major parameters or factors which controls the pressure ratio. And the normal range of a blood pressure is, normally the blood pressure is measured in of mercury. So the value lies in 120 by 80. What is this 120 by 80? Why there is two values? So these two values are called systolic pressure and diastolic pressure respectively. What is the systolic pressure? That's the maximum pressure. And when the pressure is dropping, there is a lower limit, that's called diastolic pressure. So the maximum pressure value will be 120 of mercury, and the lowest range is called diastolic, that is 80 of mercury. This is a normal pressure range for an adult human being. Now, if there is a variation, hypertension means, if it crosses 140 and 90 in the diastolic, then it's hypertension. Similarly, if it comes down to 100 and 60 diastolic, then we can call it as low blood pressure. That is also not good for the body. Now, there are several parameters we can measure. Basically it is measured. The one is pulse pressure, which is a derived parameter, which is derived from the systolic pressure, which is in short it's called SP, and diastolic pressure in short is called DP. So the pulse pressure is the difference between systolic and the diastolic pressure. For a normal range, it is 40 of mercury. And another important parameter which is also derived from the systolic and diastolic, it's called mean pressure, or normally it's called MAP, mean arterial pressure. MAP is given by DP plus pulse pressure divided by 3. That's again a derived parameter. So these are the secondary pressure parameters which also gives you an indication about the heart function. Now, this is a table where the pressure range is indicated for women as well as men. For systolic as well as diastolic, it is given, and the normal range lies between 120 and for systolic, the normal range is 120, and diastolic it lies in 80. This is also a blood pressure chart where different severity level of blood pressure is indicated. Up to 140, it can be categorized as normal, and above 140 up to 160 it is moderate stage, mild stage. Then from 160 to 180 it is moderate, then severe, then very severe, it goes on. So the blood pressure is an indication, and normally after the age of 30-35, blood pressure measurement is a very important, very normal test. Everyone needs to perform that, and we should keep a control over it. So coming to the measurement part of it, the blood pressure normally can be measured in two important ways. There is indirect method and direct method. What is this indirect method? So in the indirect method, in other ways it's called non-invasive method. Here, non-invasive means without any insertion, that is outside the body. The measurement is made outside the body. That is without disturbing the the patient or the person's normal life. That's a non-invasive method. But in the same time, there is another method that's called direct method. That's a invasive method. It's called a catheter-based method. So in that case, the doctors will be sending a catheter inside the body, and it will reach, because the blood pressure, the source of the blood pressure is heart. So if you want to measure blood pressure actually with accurate values, you need to measure it exactly at the region, at the heart. But every time for a clinical practice, for a regular measurements, the accessibility of the heart is not available. So we can go for an indirect or a non-invasive method where we can measure the blood pressure outside the body without any clinical procedures. So that's an indirect method. But the other side, in the indirect method, always it's not that accurate. It will be an approximated value. But in the case of a direct method, we'll get an exact reading. Another negative point is in the indirect method, it is not a continuous. It's a kind of a static measurement. We'll get a value. Then after a certain interval, we can take another measurements. But if you want to get a dynamic or a continuous measurement, indirect method is not a suitable one. In case the direct method will be suitable. Now we'll see one by one in detail. In the indirect method in the blood pressure, as I told you, this is a simple procedure which will be performed outside the body without any disturbance to the patient, but it has its own disadvantages. So in the indirect measurement, it's a non-invasive method. Normally, it is performed in the brachial artery, which is very close to the heart, because as I told you, if you want to measure an actual perfect measurement of blood pressure, we need to do in the vicinity of heart. So since there is a difficulty in accessing the heart, we are doing indirect way. So the brachial artery is the best location where we can get close approximation of blood pressure. Now there is other sites, forearm, radial artery, wrist, and there are so many different locations where we can measure blood pressure. But the optimal one is forearm, where the brachial artery is located. So the common blood pressure measurement in indirect method, we call it as a sphygmomanometer. Sphygmomanometer, why it is called sphygmomanometer? We use a manometer for measuring the blood pressure. So in the sphygmomanometer, a very important part is a cuff. A cuff will be looking like this, and the cuff will be wound on the forearm. So what is actually happening is, in the sphygmomanometer, the artery, as I told you, we are measuring the pressure, that is the force exerted by the blood when it is flowing through the artery. Now when you keep the cuff, we will be mounting the cuff on the forearm, and when the cuff will be inflated with the air. When it is inflated, the cuff will be squeezing the artery which carries the blood. When it is squeezing the artery, at one point, when this blood pressure and the cuff pressure, actually we are increasing the cuff pressure. So when these two pressure are equal, almost the artery will be closing. There is no more blood flow, but still the cuff pressure will be still increased little more. Normally up to 160 mm of mercury for a normal patient. It can go up to 200 or 220 mm of mercury in some rare cases. Right. Now, when it is reaching the high position, now ultimately the artery which is carrying the blood is closed. Now, after some interval, the cuff will be deflated. Deflated in the sense the pressure is decreased. When it is decreased, it will be coming down, and there will be one point when the cuff pressure is equal to systolic pressure. When it is equal to systolic pressure, the artery opens slightly. So artery opens slightly in the sense there will be a small opening in the artery, and the blood will be trying to rush towards the artery, and it will try to pass on. So when it is doing that, there will be some turbulence. There will be a turbulence created, and this turbulence will lead to some sounds. So that is called Korotkoff sound. So this Korotkoff sound will be heard with the help of a stethoscope. So when the doctor is start hearing the Korotkoff sound for the first instance, that time what is the cuff pressure? That is called systolic pressure. Now still, the process continues, and the pressure is keep on decreasing. So there is another place where the cuff pressure will be equal to diastolic pressure. When it is equal to the diastolic pressure, at that time, the artery comes to its normal size, and the blood flow becomes normal and there is no more turbulence. So at that instance, the correct cough sound stops. So when the doctor is not hearing, when the correct cough sound disappears from the stethoscope, at that moment, what is the cough pressure? That is called diastolic pressure. So the doctor can record two values, one at the start of the correct cough sound and the second one at the end of the correct cough sound. So these two sounds are actually recorded under manometer, which is connected with it. Because actually, so here you need to note down one point, why we call it as indirect method. Here we are not measuring the blood pressure directly, we are here measuring just the cuff pressure. So when the cuff pressure is equal to the systolic pressure, we that is indicated in the stethoscope by the correct cough sound, and when it is equal to the diastolic pressure, and in the other way, another way it is indicated. So in those 2 points we record the value, and that is the diastolic and systolic pressure, and that is how the sphygmomanometer works. And now this procedure is going to be same for all the indirect blood pressure measurements. But how we detect this correct cough sound? How we can, the normal, the basic method is using a doctors, using a palpatory method. They just touch the pulses and they'll feel the pulses. When there is a turbulence, they'll record the systolic, and when there is no turbulence, they'll stop recording, they'll note down the second reading. That is a basic method, but there are a lot of error, there are a lot of chances for errors, like manual error. I can hear the sound and I can feel the pulse at one instance, maybe the other person can sense the pressure. It depends on the sensitivity of the individual, so that there are chances of human errors in that. So there are many methods, modified methods, which help us to identify these two locations, that is the start of the sound and the end of stop of the sound. So by that way, the indirect method, there are so many classifications of measurements. So as I told you, the basic methodology, the technique remains same. We'll see one by one. As I told you, these are the explanations, and the cuff pressure, in the diagram it is clearly given. The cuff pressure, the cuff is wound on the artery. The pulp is there. There is a pulp. This is the pulp, and using the pulp, the cuff is inflated. This is cuff, and the cuff is inflated. When it is inflated, the artery, it will squeeze the artery where the blood is running, and the doctor can hear using a stethoscope, which is here. Now, as the same procedure, it's a non-invasive method performed by wrapping an inflatable cuff around the patient's upper arm. The cuff consists of a bag contained within a cloth sleeve. This is the procedure, and finally the very important thing is you can start hearing the correct cough sound, and the start of the sound is systolic pressure, and the stop end of the disappearance of the sound is diastolic pressure. How we find out, how we track those 2 points, that makes the method more accurate. If you can efficiently track those 2 points using this indirect method, that increases the accuracy level of the measurement. So basically there are this is a diagram which clearly explains the complete working, completely whatever we have discussed till now. This is the first, there are 3 graphs. The first one is the cuff pressure, the second one is the correct cough sound, and third one is the blood flow pulsations. Now you can see here, this is the inflation cycle. The cuff pressure is inflated and it is increasing. Now when it is increasing, at the same time you see the blood flow. The blood flow is normal at that. So when it reaches the maximum, almost the blood flow stops. There is no blood flow. Now after reaching the maximum cuff pressure, now the cuff is deflated. So it is in the negative cycle, in the negative half cycle, when it is coming down, when the cuff pressure, this is the systolic point, when it reaches the systolic pressure, the artery snap opens. So there is a slight opening. So see that the blood flow, it's a turbulent flow now. At the same instant, when the artery opens, the correct cough sound starts. This is the correct cough sound. Now the correct cough sound start. The oscillations is maximum at points. Then when it is reaching the diastolic, that is the lower limit, it goes. After that, the blood flow will become normal. Now the Kharkov sound stops at that point. So this is your systolic pressure, and this is the diastolic pressure. So this is how normally the direct blood pressure measurement works. Now, as I told you, there are several methods which helps to identify these two locations. That is the start of the sound and the end of the stop of the sound. So the very basic one is pulpatory method. The pulpatory method, we'll see one by one. The second one is oscillatory method. Then we have differential pressure sensing. So pulpatory and oscillatory are more or less the basic methods that has a lot of disadvantages. As I told you, there are the possibilities of human error is more in those two cases. Now there are sensors. We can use some sensors. The differential pressure sensing method, rheographic method, oscillometric method, and ultrasonic method, and so on. The list is big. There are so many other methods also there to find out the blood pressure in indirect way. Again, I repeat, the whole process, the working principle is same. Only thing, how you detect the exact location. This is the pulpatory method. So in the pulpatory method, and it is also called as a Rivaroki method. So in the Rivaroki method, as I told you, the doctor will be holding the pulse. He'll be holding, instead of, there is no need of any stethoscope here. Here, direct touch. So with the help of a touch, they will be sensing the pulses. When when the cuff pressure, P cuff, is equal to blood pressure, it is deflated, and they can feel the blood pressure when it is equal to the systolic and diastolic. They can feel the turbulence in the blood flow. With the help of the turbulent sensing, they can find out systolic and diastolic. As I told you, this method has a lot of disadvantages. Here only the systolic pressure can be measured, because the pulses, when the Kharkov sound stops, that is not possible to identify the stopping point using this Rivaroki method, this pulpatory method, because when it stops, your blood flow becomes normal and there will be normal pulses. There is very difficult to differentiate the normal normal blood flow pulses and the stopping of the Kharkov sound. So there is no chance we can find out diastolic pressure in this method. And of course, it has a lot of manual errors in that. And the next method is oscillatory method. So in the oscillatory method, it is kind of an palpation sensing. So with the help of hearing, so with the help of sound, with the help of a stethoscope, the doctors will be hearing the Kharkov sound start and end, and it will be detected. So about this we have already discussed about it. Yes, the advantage is very simple. It doesn't need much electronics or much sensing mechanisms. But the disadvantages, it is, since it's a sound, you can't use it in a noisy environment, and it changes. The value changes from observer to observer. Say one person will be detecting at 120, maybe the other person will be detecting the same thing at 122. So there will be a manual error. And there are other drawbacks in this oscillatory method. As I told you, these two methods are very basic methods. Now, the differential pressure sensing, that's a different technique. So in the differential pressure sensing, it is a indirect blood pressure measurement where the blood pressure is measured with the help of a sensor. Now again, the whole thing is same. We'll have a cuff. We'll have we need to wound it around the arm, and the cuff needs to be inflated and it needs to be deflated. All these things are you have to repeat it. But only thing, instead of a stethoscope or instead of a sensing touch, we are going to rely on the electronics. So here we're going to use two sensors. We call it as sensor A and B. Both are differential pressure sensors. So A is a sensor which is kept close to the arm, the patient body, and B is touching the cuff. So the sensor is kept like that. A will be touching the arm and B will be touching the cuff. So here A will be sensing the blood pressure with the correct correspondence, that is the arterial changes in the blood, in the pressure. B will be sensing only the cuff pressure. So this is clearly indicated here. You can see these are the outputs from the two sensors A and B, and the third one, this is output from sensor A and output from signal sensor B, and this is A minus B. So when you subtract B from A, we get only the arterial pressure variance. So that, this will start only at systolic point. There will be a pressure change in the artery only when there is a turbulent flow. So that is sensed only by A. B will not capture those signal. B will be capturing only the cuff pressure, but in the case of A, it will capture both cuff pressure and the pressure variation in the artery. So that the start of that pressure variation is an indication of systolic pressure, and the disappearance of that pressure change is the diastolic pressure. This way, here everything, there is no manual interruption, so the manual error is reduced. Here the sensor, if you use a high sensitive pressure sensor, and the accuracy of the measurement or the technique will be high enough, so that we can make some decision based on this measurements. So this is a differential pressure sensing method. Now there is another method where we can find out the blood pressure, that is called a rheographic method. So in the rheographic method, this is a change in impedance. So change in impedance in the sense, again the cuff will be there, inflation, deflation, all the things will be there. Only thing, how we measure, as I told you in the beginning. So the measurement is done here based on the change in impedance. Change in impedance in the sense, the skin resistance. The skin will be changing its resistance based on the turbulent blood flow. Due to this turbulent activity beneath the skin, there will be a change in the skin impedance. So by capturing the change in the impedance, the start of the change, the variation in the impedance, where it starts, that is the systolic, and where it becomes normal, it becomes the original impedance, that is the diastolic. So we will be passing a high frequency current of 100 kilohertz through the skin. It's a closed loop, we're making a closed loop. So when there is a change in the resistance, the current flow will be disturbed. So the disturbance in the current flow will be recorded. There will be two switches. One will be holding the systolic pressure value, and this will be indicating the systolic pressure, and the other valve will be closing the diastolic reading. So with the help of these two valves, the readings are closed, and it will be hold. The values will be hold there, and we can read those values like systolic and diastolic pressure. Then we have a very important measurement, that is the oscillometric method. So in the oscillometric method, vibration is the key point here. So normally, if you very normal practice, if you for gardening purpose, we'll be using pipes. We'll be watering the garden with pipe. So if you are squeezing the pipe which is having a fast flow of water, and if you slowly reduce it, slowly we release the pressure, what happens? The pipe, you can feel the pipe will be vibrating because of the force, increased force of the water. There will be a vibration. You can feel the vibration in the pipe. So exactly the same thing will happen in the artery when it is closed and it slowly, slightly it opens. So there will be a small vibration because of the turbulent blood flow. That vibration, if you can capture the vibration, the start, as I told you, it's like other methods. The start of the vibration is the systolic pressure, and when there is when this vibration oscillation stops, that is the diastolic pressure. Now this way also we can find out the blood pressure in indirect way. So here again everything, the cuff will be there, inflation deflation will be there. Only thing, instead of a differential pressure sensor or instead of rheographic electrodes, here we'll be using vibration sensors, accelerometers. So these accelerometers will capture the vibrations which is experienced due to the change or vibration experienced by the artery because of the turbulent blood flow. This vibrations are captured, and again the electronics will hold the pressure at the start of the vibration, and again it will hold one more time when the vibration stops, and correspondingly the first one is systolic and the second one is diastolic pressure. This is the oscillometric method. And one very interesting thing about this oscillometric method is, as I told you, the MAP, the mean arterial pressure, it's a derived. Normally we calculate it by the formula, but in this method, in the oscillometric method, if we plot the curve, we can get the mean MAP directly from the curve. So that is not the case of other methods like rheographic or differential pressure sensing. MAP, the mean arterial pressure, can be directly measured using this oscillometric method. So normal piezo sensors, we use piezoelectric devices. Piezoelectric sensor, which is a popular sensor for vibration measurements, which can be used to capture the vibration, and it can be an indication for SP as well as DP pressure. It is a very simple method, and very important thing is MP, the mean pressure can be measured, and the disadvantages. So the fixed algorithms, there are the electronics and the algorithms to regularize this measurement will leads to some complication in the overall performance. And the next method, which is also used for blood pressure measurement, is ultrasonic method. So here we are going to use ultrasound sensor, and this ultrasound sensor is used to find out the start and the stop of Korotkoff sound, that is the variation in the arterial pressure activity. This is also a transcutaneous, and through the skin Doppler sensors is applied. So the Doppler sensor, the working of Doppler, it's an ultrasound. Ultrasound is an acoustic wave which is above 20 kilohertz, which is above the normal audible range of a human, and that will be passed through the skin, and it will reach the artery, and when there is a snap open of the artery due to the turbulent blood flow, there will be change in the frequency. The Doppler is used to measure the vibration, the velocity. So here we use this method to find out the velocity of the blood as well as the artery, and this method is more suitable because it gives you exact reading, and it is you can also hear the sound signal using the ultrasound method. The very important advantage of this ultrasound technique is this method can be used in the noisy environment, and it can be used with infants and babies in the intensive care. So small kids can be connected with this ultrasonic probe, which is used for blood pressure measurement, but the procedure is slightly different for infants. So these are all some indirect blood pressure measuring methods. So here we have discussed the basic principle. So the basic principle remains same for all the methods. The difference is how we detect that start and end of the sound. So in that way we can classify the overall measuring methodologies, and the accuracy of the system of the overall measurement depends on how efficiently we detect the start and end of the sound. Next is the direct method in the blood pressure measurement. As I told you in the beginning, this is a highly accurate method, but this cannot be performed in a normal routine, in a normal day-to-day activity. This needs to be performed with some supervised, it's some supervised practitioner. So it's kind of an procedure where a catheter is inserted inside. Catheter is a capillary tube which will be inserted inside the body. There will be incision is made, a small opening is made, and through the opening the catheter will be sent, and the catheter is expected to go up to the heart where the pressure is generated, and the pressure will be measured at that same location. That is the direct method. So of course it will give you very accurate reading, and there is no chances of any error. But the drawback is it is complicated procedure when it is comparing with the indirect method. And another thing, the procedure, the cost is high, and of course it gives you errorless reading. And one more thing, this will give you a continuous, say, so for a patient who is in ICU and who is under regular monitoring. So for those kind of patient who is recovering from a heart surgery and all that, say in that case, or in during the heart surgery, if they want to monitor the blood pressure continuously, then they can go for this direct method. In those cases, indirect method is not a suitable option. So the general facts about the direct measurement is, it's of course it's an invasive measurement, because we are disturbing the patient by inserting a catheter inside the body. A vessel is punctured and the catheter is guided in. The most common sites are brachial and radial arteries, but also other sites can be used. There are two types of direct blood pressure measurements. There is two variation: extravascular sensor and intravascular sensor. So how we, if you are sensing the pressure at that very one location where the pressure is generated, that is called intravascular sensing. If you are sensing of the blood pressure, it is happening outside, then it's called extravascular sensing system. We'll see one by one. So in the extravascular sensing, the sensor is located behind the catheter. So the catheter is a saline filled catheter. So that doesn't carry the sensor. Sensor will be outside the body. So the catheter will be filled with the saline, and it will be sending in, it will be going inside the body, and it will reach the location where exactly the blood pressure is going to be measured. Then you can see here in this picture, this is the diaphragm, and this is the exact location where the pressure is measured. Now this diaphragm, this is the sensor which is kept outside the body. Now the pressure will be carried through this tube which is running from the heart. So the pressure will be experienced by a layer which will be going inside, and which is another end of the catheter, which will be touching the location where the blood pressure is generated, and that pressure will be transmitted hydraulically, because the saline is transmitting the blood pressure. The pressure is taken out, and it is measured outside the body. So that's why it's called extravascular sensing. Now there are so many pluses and minuses in this extravascular sensing method. The sensor which is used is not directly coming in contact with the blood. Only the saline is coming in contact, and the pressure is measured in the sensor. So you can, after sterilization, you can reuse the sensor. And another thing, the drawback of this method is, if there is any air bubbles or any foreign bodies present in the saline, it needs to be clearly purified, or it should be cleaned properly. Or if there is any presence of any foreign particle or any substances like air bubbles, that will reduce. Say if a pressure is sensed, and if it is the pressure is transmitted through the saline, if it is coming across through some air bubbles or some substances, there is a chance the pressure drops. So the sensed pressure by the catheter and the actual pressure measured by the sensor will be a different values. So there will be a gap between the actual pressure and the measured pressure. So there is a drop in the accuracy. So that is a very important thing. Another thing, the catheter, it is the catheter is running through the body. There are so many bends. So when the catheter is running through the bends, the pressure is transmitted. There is a chance the pressure drops in every bend. So when it reaches to the sensor, actually the sensed pressure and the measured pressure will not be equal. There will be a gap. So that also reduces the accuracy of this measurement. So these are the drawbacks of this extravascular sensing sensor mechanism. So what is the solution? So the solution is, instead of keeping the sensor outside, why can't we fix the sensor in the catheter tip, and why can't we send it inside so that the measurement is performed therein. So where the pressure is sensed, there itself the measurement is done, and only the signal is transmitted outside, and we can read the value outside. So that is the intravascular sensing system. So that is other way, it is a disposable sensor. Now for extravascular sensor systems, we can use different types of sensors like strain gauges, variable inductance type, variable capacitance, optoelectrical sensors, piezoelectric sensors. So many different sensors like diaphragms, different pressure sensors can be used. And the size doesn't matter here actually, because we are keeping the sensor outside the body, so we can use different range of pressure sensors. And of course the high end pressure sensors, if you are using it, the accuracy increases. Only thing, the problem in the transmission. So when you are carrying the pressure which is carried through the saline, there is a chances of pressure drop. If that can be that can be compensated, or it can be nullified, then the extravascular sensing system gives you good results. Now, the solution for that extravascular sensor drawbacks is the disposable sensor. So, as I told you, the disposable sensor is a mechanism where the sensor is fixed in the tip of the catheter. The catheter will be carrying the sensor along with it. So, when it is reaching the spot, there it will be sensing the pressure therein, and it will just transmitting the signal. So there are different types of sensors like Teflon sensor, polyethylene sensor, silicon rubber, and so on. So the performance, the Teflon gives you a better outputs, and there are different ranges. Now the problem in the disposable sensor is the life. So the life of sensor is you cannot reuse it. It's a disposable sensor. Of course, when it is whatever you are going for the disposable kind of system, then the cost of the measurement increases comparing to the extravascular sensing system. But otherwise, the accuracy is very good, and it gives you exact reading, and also it gives you a continuous reading. So this is about the blood pressure measurement. So here I have given you complete details about blood pressure measurement. We have seen what is blood pressure, what are the different methods of blood pressure measurement. In each method, we have discussed some technique and the differences in the technique, pluses, minuses of that technique, all that things we have discussed. So here the conclusion is blood pressure plays a very important role in the cardiovascular function detection. So as I told you, if there is a increase in the pressure or decrease in the pressure, that's an indication that there is something wrong with the heart function. At least in the long run, we need to rectify that. We need to bring back the blood pressure to the normal range, that is 120 mm of mercury to 80 mm of mercury, that is systolic and diastolic pressure. If it crosses 140 or if it comes down 90 in the systolic, then it needs to be treated. So the treatments are like proper, the lifestyle modification by proper dieting, exercise, and in case if required, medications. Through that, we can control the blood pressure and we can have a healthy life. To continue with the next topic, it is all